Protect your DNA. BioPQQ can promote formation of new mitochondria. Infowarsstore.com.
There is a war. It's happening now. It will decide the fate of humanity. The time to choose sides has come. We are the resistance. We are the Infowar.
Welcome to the Infowars Nightly News. It is Tuesday, October 14th, 2014, and I'm Leanne McAdoo. Here are tonight's top stories.
Tonight, the CDC's new consideration to stop Ebola. Then, Obamacare cost won't be revealed until after the election. And GMO labeling is deemed unscientific by the Scientific American. That's next on the Infowars Nightly News.
If you just consciously faced it, there would be no debate about joining the Republic. No debate about fighting this.
Well, first, an update on the 26-year-old Dallas nurse who's being treated for Ebola. Nina Pham is being given a decades-old, possibly life-saving treatment that academics and health officials agree could be one of the best means to fight Ebola. It's not an experimental vaccine, but a blood transfusion from Dr. Brantley, who was the doctor who survived and has since recovered from Ebola after he contracted it in Liberia. He has given his blood, which of course has developed antibodies to this disease, to two other patients as well, both of whom seem to be on the mend. Brantley himself received a blood transfusion prior to receiving the experimental drug ZMapp. Now, scientists say they're going to be closely following these survivors of Ebola. They want to somehow find a cure from the so-called gold in their blood that helped them to survive this very serious disease. Now, the treatment is nearly as old as Ebola, the discovery of Ebola itself, but of course there are complications because they can't do blood transfusions with tainted blood, as well as the fact that Ebola outbreaks are very rare. They kind of flare up and then they disappear. That's, of course, what you hope will happen if it can be contained. So that's the big issue here facing the United States, is how to contain it. Now, we've got some reports coming out today that possibly the boyfriend of this Dallas nurse is also being isolated. Now, up to 70 hospital staffers came into close contact with Thomas Duncan. They drew his blood, put tubes down his throat, wiped up diarrhea, analyzed his urine, and wiped saliva from his lips, even after he had lost consciousness. Now, they say that the size of this medical team reflects how their intense efforts to save Duncan's life, but it also suggests that many other people could have been exposed to the virus during Duncan's time in an isolation unit. Now, of course, it's a 21-day incubation period, so we just need to see, but this is what's happening, is that we aren't closely monitoring now 70 people and all the people that they've come in contact with. A nurse at Dallas Presbyterian Hospital told a local television station she fears Ebola may be airborne.
We are wondering, is it really contact? Is it contact and airborne, or is it just really contact and there may have been a breach of protocol? We really don't know.
Now, on Monday, the CDC said that Pham had contracted Ebola due to a breach in protocol, saying that she had removed some of her protective equipment. However, other nurses are also concerned that this disease is now airborne. They're joined by national experts on respiratory protection and infectious disease, who too believe that Ebola may now, in fact, be airborne. Doctors with Center for Infectious Disease Research and Policy say nurses should be wearing respirators, not face masks. The chief scientist of the National Institute of Allergy and Infectious Diseases believes this current strain of Ebola is more virulent than others, and he argues that anytime the virus replicates, it will mutate. Now, a doctor at the border fears that this has already happened, that Ebola virus has already mutated. This is the infectious disease specialist, Dr. Michael Jelenic, and he says that his biggest concern is that we don't have enough knowledge about the virus and this outbreak and whether it's mutated or not. The doctor says that from an infectious disease standpoint, Ebola is still a bit of a mystery. It's known how to stop the transmission of HIV or the flu, but he says it hasn't been fully defined how to stop the transmission of Ebola. And as we've reported before, they really haven't done any tests to prove or disprove whether or not Ebola can be transmitted through coughing or sneezing. They have run no tests to see if that is possibly an issue. Now, Jelinek's also saying he's not putting his complete faith in the powers that be who say, oh, there's nothing to worry about, because he says that they say, we don't need to worry about anything. We've got it all under control, but under control means that no one else is going to contract the disease. Now, his concerns are also echoed by many other health professionals who are now raising concerns over this potential airborne spread. Despite the best efforts of the government to tamper down public panic, this is something that should be of great concern to the public.
I mean, this is just no-brainer. No-brainer quarantine. They're going to wait till it spreads and quarantine everybody and forcibly inoculate us. Just get ready. They may not do it this time. This is a beta test, though. Mark my words, they're doing it on purpose. And so I'm to blame. I understand. Let's have some more CNN reports and another Washington Post attack piece like last week. And just because we're so bad.
I think they should set up special centers for just Ebola in each state.
Mass quarantine is the major problem that you face because as this sheriff's deputy, he came in down with some flu symptoms and he got labeled potentially Ebola and put into quarantine. Had this happen in a mass quarantine situation where a lot of people are coming down sick with it, and you happen to have the flu or a cold or fever or something and get tagged and put into a mass quarantine, you're going to get the Ebola because you're put into a quarantine with other people. And just like the Superdome during Katrina, you're not going to have the kind of facilities. I don't care what the CDC says. You can't have extremely controlled medical protocols in mass quarantine situations. It simply overwhelms the medical system. Even in Liberia, you know, they're already out of hospital beds. And how do you build more facilities to handle the exponential increase in clients?
Just yesterday, the nation's largest nursing organization, National Nurses United, which does not appear to have members in Oregon, released troubling results of a survey of 2,000 of its RNs. 76% said their hospital has not communicated to them any policy about admitting a patient with Ebola. 85% said their hospital has not provided education about Ebola with the ability for nurses to interact and ask questions. And 37% said their hospital does not have adequate supplies.
So how to control the spread of Ebola? Well, rather than stop it directly at the source, which is what they say their big aim is, they're not stopping flights from leaving the country, entering other countries where this disease does not exist. The CDC now indicates that it is willing to place registered nurses and physicians at all major airports in the U.S. to screen travelers for signs of Ebola. Now, this is according to a Fed BizOps notice that's posted today. It's entitled Ebola Support Services. The CDC is looking for a company to provide clinical personnel and epidemiologists that can do contract tracing and traveler rapid assessment of health status. This is both overseas and at domestic airports within the U.S. As of right now, only 5 airports within the United States are set to begin temperature screenings of travelers that are returning from West Africa. Now, of course, experts have questioned the effectiveness of airport screeners because, of course, fevers can be suppressed with large amounts of ibuprofen. So again, where is the real effort to stop this disease at the source and stop flights from leaving? Now, other third world countries have been able to do just that. They've stopped flights from Liberia coming in. They've been able to secure their border. They have quarantined large numbers of people in the case of Nigeria and have been able to really keep the spread of this contagion from affecting their population. Why can't the United States? Well, one conservative leader has accused this current administration of allowing infected illegals and others to swarm America to create a pandemic that could lead to martial law and the canceling of the 2016 elections. This is Michael Massey, and he accuses the president of providing safe harbor for disease-carrying illegal aliens who are contributing to the resurgence of illnesses like polio, tuberculosis, and measles. And these are diseases that have already resulted in loss of life of American children. He goes on to suggest that such crises could build to the point where they may threaten the 2016 election. And he asks, what could be more economically devastating than a disease pandemic and martial law to prevent a run on banks and to allow government-controlled media blackouts? Now, a lot of people speculated that Former President Bush was going to do the exact same thing leading up to the 2008 economic collapse. But consider this, Liberia has already pushed back their elections. They are in the throes of an Ebola pandemic there as well. And as we have pointed out, the fear of Ebola, even just the fear of Ebola, will be used to take away liberties even more. I mean, they're asking to set up FEMA camps in every state. Now we're having to quarantine travelers. Of course, just before the first case of Ebola was reported in the U.S., the president altered his authorization to detain people for simply showing symptoms of Ebola. And right on cue, the establishment media is calling to set up these FEMA camps in every city. This is Fox News. They want to quarantine those just showing signs of disease. It's the exact language that is in that authorization.
DNA force. When cells become toxic, they die early and aging sets in. DNA force. No one has put together a formula that focuses directly on brain health, nerve growth factors, and optimizing your cellular energy at the same time. Just one of the key compounds, BioPQQ, is backed by major clinical studies. DNA force. We now have the synergistic solution. Secure your DNA force today at InfoWarsLife.com or call toll-free 888-253-3139. DNA force.